And good morning to you. Welcome to Orlando Matters. I'm Keith Landry. Hope the weekend is off to a good start. We are talking about two very important issues here in Central Florida, healthcare reform and transportation. And an expert on both of them is Congressman Mica, District 7. Been in Congress for 17 years. You got a thing or two figured out. I want to thank you for being here on Orlando Matters this Saturday morning.
Good to be with you.
You bet.
And thank you for the compliment. I will admit to being somewhat of an expert on transportation, but health care maybe not.
Right, I think we're all still figuring it out. And let's start with health care because there's been so much interest in that this summer. You had your August break where you were down in the district the whole time and listening to constituents. What are they saying to you about health care reform? What are they interested in and what are they not happy about?
Well, the break was interesting, and I think not just in the 7th Congressional District, but across the country. And from time to time, Americans come out. Most of the time, Americans are pretty placid.
Right.
They speak out a little bit on politics and issues, but from time to time, there's overwhelming wave of public sentiment.
Yeah.
And I think it was expressed not just in the 7th District, but across the nation in opposition to basically the government taking over or proposing a government health care plan.
The so-called public option.
Yes, the public option. I think there was a lot of opposition. Again, probably 10-1 in my district, and pretty much a majority of Americans across the country expressed concern about what was proposed, again, in the House Bill H.R. 3200, about 1,200 pages, setting up a government or public option.
Do you think we need health care reform in America?
Absolutely, absolutely. I'm sure if I asked you, you'd say your health care premiums were too much, and most Americans have seen the escalating costs. So I think we do need to reform health care, but the way this is done is setting up a public option or government plan, getting them into it, and then underwriting it also by the taxpayers, and some cuts in some other programs like Medicare, which I don't think is the way to go. But we definitely have some problems. People do have high premiums. They have difficulty in accessing health care sometimes because of cost or pre-existing condition. We've got folks that lose or change jobs that need coverage, and then we've got a lot of folks that fall through the cracks. But finding a way to cover those and responsibly address the problem, I think, should be our objective.
Congressman Mica, you've been up on Capitol Hill for 17 years. You know how the process works. You've seen how issues come and go and when they get through and when they fall by the wayside. Are we going to get some kind of health care reform in 2009 or 2010?
Well, maybe the good part about this debate is we'll see some attention to some of the issues I mentioned. Cost, access, people losing or not able to get insurance. That could be good results from all of this debate. I think the public option was probably well intended, but again, the reception was pretty negative across the country. But from these ashes, maybe will rise some good reform.
Do you think that, is there an alternative to that public option? Are there other ways that you can get the same things done that they were trying to accomplish with the public option?
Well, again, you got to look at the core of folks that don't have insurance, about 40 million people, and then say, who do we cover and how do we cover them? Right. There's some folks I don't think should get coverage. People, they're about 10 million, they estimate, illegal aliens, and I don't think that's our obligation. There are probably about 10 million people that lose jobs, change jobs, and we should find some way through adjusting COBRA to assist some of those folks. There's some folks that choose not to get health care that make, it's estimated 8 to 10 million people who make $80,000 or more and just, they don't get it. They're a small business person. They have other things they want to spend their money on, sometimes young folks. Then there's another category, I think, of people. It's interesting, there are about 8 to 10 million other people who are eligible for Medicare. Medicare is for folks who don't have income or needy folks. There are many children who are now covered by expansion of S-CHIP that don't get the coverage. So getting some of the services, community health services, to folks, or Medicare and other assistance programs to that large gap that doesn't, for some reason, even sign up or know those programs are available is another challenge.
What do you say to those, maybe it isn't 46 million, maybe when you pare it down as you just did, maybe it's 20 million, whatever it is, but what do you say to those 20 million or however many million American families who either don't have health insurance or are underinsured? How patient do they have to be while Congress goes back and forth on this?
Well, I think Congress should step up to the table. We are a very wealthy nation, and we should find some means. The trick is the balance. If you have the government underwrite just about any activity, the private sector can't compete. What we don't want to destroy is the health care coverage for about 75–80% of the folks that are happy with it. They're not happy with the price. The premiums. I haven't had many people come up and say, I'm just pleased as punch about my cost of health care. But again, addressing the fundamental problems, getting access to people that don't have it. So maybe we can do that and help those people now rather than later.